Once people pass 60, there's one quiet thief of independence that affects millions. It's not heart trouble, it's not blood sugar issues, and it's not even joint pain. It's a particular kind of discomfort that starts deep in the hip, spreads through the seat, travels down the back of the thigh, and can even go all the way to the foot. This pain often feels like a burning shock or a tight, piercing pull. So many hear it's just part of getting older or something they must tolerate. Gradually, they become less active, sit more, and start to feel afraid of their own movement. But here's the reality. Most people over 60 are never informed this pain isn't typical, and it isn't something you have to resign yourself to. That shocking, traveling pain has a name: sciatic pain. And in most older adults, it doesn't actually start in the leg. Studies indicate over 40% of people over 60 feel sciatic-type pain. Yet, many are addressing the wrong place with the wrong actions, or depending on medicines that only cover up the problem. What truly surprised us was learning that when older adults use the correct movements in the proper sequence, relief can come not in weeks, but in minutes. Today, I'll show you the only 4 movements you really need to ease sciatic pain at its source, safely, gently, and made specifically for those over 60. Before we go on, let me ask you something quickly. How old are you? And where are you joining from today? And where does your discomfort go? Down the back of your leg, along the side, or into the foot? Share that below. I read every comment because your experience helps other people over 60 see they aren't alone in this. Let me share why this matters so much to me, and why I look at sciatic pain differently than most tips you find online. For a long time, I've worked directly with older adults and followed hundreds of real experiences, from people in their mid-50s to late 70s, dealing with back and leg pain, observing what truly helps and what doesn't in everyday living. I've watched people rely on painkillers just to manage daily tasks. I've seen others gradually move less out of fear of worsening the pain, and I've heard the same phrase again and again. Maybe this is just how getting older feels. What became clear over time was a consistent theme. Relief didn't come from pushing harder, stretching more forcefully, or avoiding activity completely. It came when people started to understand how aging bodies react to movement in their own way, and when they selected movements that cooperate with the nervous system rather than battle it. The most important change wasn't a new medication or a popular fitness trend. It was realizing that the right kind of movement, done gently, with purpose, and regularly, can alter how the body feels even later in life. That understanding guides everything I offer here. If you've been managing sciatic pain for some time, you've likely already tried what's commonly suggested. You might have stretched your hamstrings, pulled your calf muscles, massaged the sore spot, used heat or cold packs, or taken pain relievers just to make it through the day. Some are even advised to walk more, believing activity alone will fix it. The problem isn't a lack of effort. The problem is focus. Sciatic pain seldom begins in the leg, even though that's where it's felt most intensely. In adults over 60, the real origin is usually farther up, in the lower back or deep within the hip. With age, spinal discs thin, joints stiffen, and certain deep muscles tighten from years of sitting and reduced mobility. One very common trigger is a small but strong muscle deep in the hip that can pinch the sciatic nerve without you even knowing. When you stretch only the leg, you're pulling on tissues that aren't creating the pressure. Sometimes, forceful leg stretching can even aggravate the nerve, increasing pain rather than easing it. Medications may numb the feeling briefly, but they do nothing to lessen pressure on the nerve itself. Once they wear off, the pain returns, often with more stiffness and less trust in your body's ability to move. This is why so many feel stuck in a cycle. Pain, pills, rest, fear of activity, then more pain. Over time, this cycle leads to weaker muscles, poorer balance, and even more strain on the spine. The real answer needs a different method. You must first ease the structures that are pressing on the nerve, then lessen pressure on the lower spine, and finally, stabilize the body so the nerve stays safe during everyday motion. Without this order, relief is often temporary or partial. And this leads us to the 4 movements I'm going to show you. They're designed not to follow the pain, but to gently address its origin, especially for bodies over 60. After years of helping older adults in pain, we stopped searching for shortcuts and began looking for common threads. We examined hundreds of exercise plans, rehab techniques, and treatment approaches. What became obvious was this: most methods fail because they do too much too soon or concentrate on the wrong place. In time, we distilled everything down to 4 fundamental movements. Not random stretches, not strenuous workouts, but therapeutic exercises chosen specifically for bodies over 60. These moves follow a careful sequence that honors how the aging spine and nervous system respond to load and motion. The aim is straightforward, but effective. First, we release the deep tissues compressing the nerve. Second, we lower pressure on the lower back. Third, we create room so the nerve can settle. And finally, we stabilize the body to keep the pain from coming back. These 4 movements need no special equipment, take just minutes a day, and can be done safely at home. Most importantly, they work with your body, not against it. Let's start with the first one. Movement 1. Hip deep release. We begin with the movement that often brings the quickest sense of ease for people over 60 with sciatic pain. It looks simple, maybe too simple, but in practice, it tackles one of the most ignored causes of nerve pressure in older adults, the piriformis muscle. The piriformis is a small, deep muscle inside the hip. You'll never see it in the mirror, and most have never heard its name. But when it tightens from years of sitting, stress, or natural age-related shifts, it can squeeze the sciatic nerve directly, like a clamp. When that happens, pain spreads from the seat down the leg, often sharply and without warning. Research and clinical experience consistently show that easing tension in this deep muscle can greatly reduce sciatic symptoms, especially in older adults, whose flexibility and joint space have already changed with age. This is why starting here matters so much. To do this movement, sit on a firm chair with both feet flat. Rest one ankle gently on the opposite knee, making a figure 4 shape. Sit upright, relax your shoulders, and lean forward slowly just a few inches. Don't push the motion. You aren't trying to stretch forcefully. You should sense a deep but comfortable stretch high in the seat. Hold this while breathing slowly in through your nose and out through your mouth. With each exhale, let the hip soften. Stay for 20 to 30 seconds. Then slowly, sit back up. Repeat on the other side. If sitting is uncomfortable, you can also do this lying on your back, crossing your leg the same way, and gently bringing both knees toward your chest while supporting the thigh with your hands. Many older patients tell me this is the first time they feel the pain stop shooting down the leg. That's a great sign. When the piriformis relaxes, the nerve finally has space. And once that pressure starts to lift, we're ready for the next step, reducing strain on the lower spine itself. Movement 2. The resting Z posture. After releasing deep hip tension, the next step is to lower pressure on the lower back. This movement, which I call the resting Z posture, is often described by older adults as the first position where their body finally feels supported, not stressed. As we age, the discs in the low back naturally lose thickness, and the joints become less tolerant under weight. When you stand or sit for long periods, gravity increases compression on the sciatic nerve. The resting Z posture works by temporarily removing that load, letting the spine and nearby muscles relax without effort. To perform this movement, lie comfortably on your back on the floor or a firm bed. Place your lower legs up on a chair, sofa, or bench so your knees are above your hips. Your body will naturally form a gentle Z shape. Let your arms rest at your sides and allow your lower back to settle onto the surface below you. In this position, the lumbar spine flattens a little. Tension in the surrounding muscles drops, and pressure on the sciatic nerve decreases. Many notice the sharp or burning feeling down the leg starts to fade within minutes. Breathe slowly and naturally while you stay here. Don't force your breath or try to stretch further. Simply let gravity do the work. You can remain here for 5 to 20 minutes, depending on comfort. For extra benefit, placing a warm towel on the lower back can further encourage muscle relaxation and blood flow. This posture is especially useful for those with spinal narrowing or disc changes, which are common after 60. When you're ready to come out, roll gently to one side first. Pause, then use your arms to help you sit up slowly. This avoids sudden strain. Once pressure on the spine is eased, the body is ready for the next step, creating space for the nerve to move freely again. Movement. 3. Gentle seated forward bend. Now that we've released deep hip tension and lowered pressure on the lower back, the next step is to softly create space where the sciatic nerve travels. This movement is especially helpful for people over 60 who find their pain increases when standing or walking for long periods. As the spine ages, it often responds better to a gentle forward bend than to rigid upright positions. Seated forward bend uses this natural tendency. By leaning forward in a controlled way, you allow the spinal bones to separate slightly, lessening irritation around the nerve. To do this movement, sit on a solid chair with feet flat and hands resting on your knees. Slowly slide your hands down your thighs as you let your upper body fold forward. Allow your back to relax rather than keeping it perfectly straight. Let your head and neck drop naturally, as if setting down a weight you've been carrying. Pause here a few seconds, breathing comfortably. Then return upright slowly, building your spine back up one section at a time. Move without hurrying. The goal is smooth, controlled motion, not how far you go. Repeat this 5 to 10 times, staying well within a pain-free range. Many notice that as they do this, the pain begins to withdraw upward toward the hip instead of traveling down the leg. This is a positive sign, often called centralization, showing reduced nerve irritation. This movement is particularly useful for those with spinal arthritis, disc changes, or narrowing in the lower back, all common reasons for sciatic pain after 60. However, the motion should always feel gentle and relieving, never sharp or forced. Once the nerve has more room to move and settle, the final and most crucial step remains, teaching the body how to protect that space through stability. Movement 4. Deep support activation. This last movement is the one most people overlook. And unfortunately, it's also why sciatic pain so often returns. You can release the hip, lower spinal pressure, and create space for the nerve. But without stability, the body will eventually return to the same patterns that started the problem. After 60, the deep supporting muscles of the abdomen naturally weaken if not used properly. These aren't the surface abdominal muscles you see. They're the deep core muscles whose role is to guard the spine during simple motions, like standing, walking, or turning in bed. When they don't do their job, the spine becomes vulnerable, and the sciatic nerve is easily irritated again. This movement isn't about strength or intensity. It's about control. Lie on your back with knees bent and feet flat. Place one hand on your lower belly and the other on your chest. Take a slow breath in through your nose, then gently exhale through your mouth. As you exhale, lightly draw your lower abdomen inward and press your lower back softly toward the floor. The motion should be slight, hardly visible. Hold this gentle engagement for 3 to 5 seconds. Then relax fully. Repeat this 5 to 8 times, focusing on smooth breathing and relaxation, not effort. Once this feels comfortable, you can progress slightly. Activate the abdomen the same way. Then gently lift your head and shoulders just a few centimeters off the floor. Don't pull your neck or rush. Hold for 1 or 2 seconds, then lower slowly. This small, controlled action trains the deepest stabilizing muscles of the core. Over time, patients often say they feel more secure walking, less fear when rising, and greater confidence in daily motion. When the deep core is engaged, the spine is supported. And when the spine is supported, the sciatic nerve is no longer under constant threat. This final step turns short-term relief into long-term protection. Let's take a moment to put it all together. Instead of chasing pain in the leg, you've now learned a totally different approach. First, you release deep compression in the hip with the hip deep release. Second, you lower pressure on the lower spine using the resting Z posture. Third, you create space for the sciatic nerve through the gentle seated forward bend. And finally, you protect that space by activating the deep support muscles that stabilize your spine. Contrast this with the old way many still follow after 60. Pain medication might dull the symptoms, but it doesn't remove pressure from the nerve. Random stretching often targets the wrong area and can even increase irritation. Avoiding movement may feel safe at the moment, but over time, it weakens the body and increases dependence. These 4 movements work differently. They respect how the aging body changes. They focus on the true origin of sciatic pain, and they take far less time than you might think, often just 10 to 15 minutes a day. Instead of managing pain, you're teaching your body how to move safely again. And that shift from fear to confidence is what makes lasting relief achievable. If there's one message I hope you take from this, it's this. Sciatic pain after 60 is not a life sentence. Your body isn't broken. It's simply asking for the right kind of movement, done with patience and consistency. You don't need to do these movements perfectly. You only need to begin. Even practicing 1 or 2 each day can start rebuilding confidence, stability, and comfort in your body. Over time, small daily steps create powerful change. I invite you to tell me in the comments which movement you plan to start with first, or where you feel the most ease. Your story might help someone else take their first step toward feeling better. If you found this helpful, please subscribe so you don't miss future videos made specifically for people over 60 who want to stay active, independent, and free from pain. And if you know someone struggling with sciatic pain, share this with them. Sometimes the right movement at the right moment can change everything. We move forward together, one step at a time.